Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today, we have a most beautiful, very successful, and very popular obstetrician and gynecologist, Dr. Parimala Devi, who has set a Guinness World Record in the cancer detection camp, cervix cancer. And apart from that, she is a colposcopy as well as the robotic surgery she's doing. But she is concerned about the increased number of caesarean sections nowadays compared to the olden days. Including her and me, we were all born at home. But then, at what cost? It used to be risky for the mother, risky for the child, and hence, now the technology has improved and the technique and facilities are available. So, should we take the risk is another point. So, welcome, Dr. Parimala Devi. And please tell us why the cesarean section incidents are going on, what are the indications, and why do you prefer to do cesarean section in certain cases?
Respectful pranams, madam. You are my teacher, always teacher and a mentor. I am a great fan of your channel, that food, adhyatma, and also about
Arogya.
another thing, arogya, health, that is in English. Adhyatma, arogya, and health. This channel has really brought lot of knowledge. We need not think that we know everything. There is so much of a mixture of such beautiful things. Everybody should see this channel, and I would like to be part of this always. Today's topic, you have brought it with a big vision. You may be doing robotic surgery, you may be doing non-invasive cardiac surgeries, or going to the space, and there's the normal delivery is normal delivery. And why normal delivery is so important is because we have to have a lot of health for the baby once it is born. A normal delivery is a process where the baby will grow up to 9 months. Very normally, it is a low risk pregnancy, actually, we can say. Then it will pass through that last 10 centimeter of the birth canal and come to this world with lot of immunity.
Show with the
with a lot of
specimen.
immunity, so
Yeah.
that yes, it will come with lot of immunity. And this 10 centimeter of the canal, this is not a cakewalk actually. Even though the baby will grow up to 9 months, and the head and its assimilation to the pelvis. Pelvis is this is a soft structure actually. There will be pelvis which is in the what we call it as the pelvic girdle, we can say. That capacity of the pelvis is something like a socket. In that, the baby's head should sit like this. So when the baby's head sits, that is called as engagement of the head. That is nearly about 9 months it happens. It's compared to the engagement of the marriage and all, where they both will be tied up to get married. It's not like that. So here also it should one to one, it should get actually
Engaged.
stuck to each other, and it should pass through once the labor pain comes. When it passes through that last 10 centimeter of the birth canal, it can go through lot of compression, and also it's sometimes a very difficult journey, we can say. So when this normal delivery happens without any problem, the patient may be very young, the pregnant lady, and she might have had no risk or anything like metabolic problems or anything. She may be quite a hardworking lady where she is not sedentary in her lifestyle. That time this can happen very easily. Like in our days, about 5 decades ago, 4 decades ago, we all were born in the home only because of normal delivery. Because that time it was something a woman used to carry least risk of a higher age or any other problems. So, but in that era also, there were so many things which were not noticed by the society. The mother would die because of normal delivery not happened properly. The baby would die, and there may be lot of the health problems for the mother. All these things were not noticed because those days it was something like technologically it was not so much well developed. So she is gone after the delivery. She is gone means she is replaceable, like that it is the days. So like that, normal delivery has got lot of advantages, and if it happens at a proper particular age and everything is very well coordinated, I would
Before
use this word.
28 years,
The
that is without becoming elderly primary, before 28 years, if they deliver, it's okay.
Yes, yes, elderly preemie, no obesity, no hypertension, no diabetes, and she just married 1 or 2 years, not a very long period of fertility problems, all these things. Because in normal delivery, definitely a mother can immediately, within few hours, she can get up and take care of herself. Even though on the contrary, cesarean, some delay may be there, and also breastfeeding, everything goes very smoothly because she has
Yes.
not had any cesarean scar or anything. But
Okay.
this is not that easy all the time, because in once a pregnant lady comes and reports herself as a pregnant lady in 2 months, from that time their journey starts with us, and we have to follow them up till the 9 months, because she may develop some or the other problem, and baby may not grow to that extent. She might have had a long period of fertility. She might have conceived through some test tube baby because of sperm problem in the husband, or because her eggs are not coming out, because of her obesity, diabetes. She may not be able to conceive on her own. That time we will have given a lot of support to her by through the in vitro fertilization or ICSI or some of the reproductive technologies. Or she may be having a lot of abortions because of the
Yes.
cervical
Yes.
canal, which is very loose. So because
Hmm.
of that, 3 months, 4 months, she will conceive and baby will just escape without her
Just follow.
knowledge. Also
Yeah. Yeah.
painless abortion. All these things, when it is there, we have to take a lot of care, and we have to stitch her cervix also. If it's a
Hmm.
IVF pregnancy, we have to stage by stage, we have to assess the baby weight. Now I have one lady with diabetes, everything from 2 months. We are trying to keep a watch by myself, diabetic specialist, and she has some hypertension also by a cardiologist. Like this, it becomes a team. So in that
Yeah.
case, we cannot
Multi-speciality
play
team.
fool
Yeah.
with the patient's life and patient baby by giving a normal delivery, because as I said,
Yes.
when it passes through this last 10 centimeter, it is going to have a lot of compression of the head, and this is a baby which is conceived with a lot of technological support. It may pass meconium, the motion may be
Hmm.
passed by the baby, and it may drink itself.
Yeah.
Because of that, there can be heartbeat distress, like how
Yeah.
in
So the
ECG,
meconium's
in
aspiration
advanced
can occur, and then the lungs also will be problem. Breathing
lungs
will be
also will fill
problem.
with
Yeah.
meconium. It may be born as a very sick baby. It may not
Yeah.
cry only. You know, the first cry of the baby is so
It's
important
so
actually.
important. Yes. Yes.
We may cry afterwards for many things in life, but the very first cry is
First
very
cry
much
is very important. Yeah.
welcomed by us as doctors group, because that will open up the lungs and the brain,
Lungs.
and
Yes.
baby will start growing its milestones from there. So to
Yes.
put it is just the delivery. We have to deliver a healthy baby. That is very important. In pregnancy, what happens? It is a physiological process, but it will immediately can get converted to disaster because of heavy this one bleeding after the delivery, because of the baby not breathing properly. So the happiness of welcoming the baby may be taken off
It's
totally because of
yeah,
some problem
vanished.
which will come across during the labor. So it is
Yes.
not that cesarean section is purposely planned by the medical team or anything. It's for
Hmm.
many particular reasons. Madam, I
Hmm.
want to share one point. If a
Hmm.
lady who has not done even a single work at home, she is only just sitting all the time with 100
Lazy,
kgs, comes
sedentary
with a
habit.
baby
Hmm.
which is very small, then you cannot sit and ask her for a normal delivery. She herself will tell, please take my baby out through the cesarean. There is a court of law which has upheld now. If a lady asks for voluntarily for cesarean section, we are supposed to give. Unless there is some reason, we can suggest. But we are supposed to actually, what to say, like agree with her demand for
Obey the
cesarean.
request of
The
the
demand,
mother.
the
Hmm.
demand for cesarean section, one law only is there. But
Hmm.
the rate of cesarean section, definitely it is increasing because the delivery age is increasing, and the medical problems are increasing, and also a lot of technological facilities are used in getting the pregnancy. So because of all these things, and also because of women's age has increased, and her power of flexibility of the body, the muscle power, which is very
Hmm.
flexible, is not there now, because they may be in some
Hmm.
sports medicine also. They may be in some kind of condition where they are not able to walk around, sedentary jobs also. So in all these things, cesarean comes as a ramabana for us. It rescues
Yes.
us
Yes.
to help the
Rescues the
mother
mother
and
as well
the
as the baby.
baby.
Yeah.
But
Hmm.
normal delivery has got its place always and always. We were
Hmm.
always taught by our
Hmm.
professor, with all the respect, Dr. Kaulgood and team,
Hmm.
that watchful expectancy, masterly inactivity. We have to keep on observing her when we leave her for normal labor. Then,
Hmm.
when there is some problem, you turn that masterly inactivity into masterly activity and see
Activity.
that they both are safeguarded.
Yeah.
So
Yes. Yes. Yes.
blindly it is not increasing. On the higher side, it is there, but we have to use our judgment and see that the normal delivery chances are also given, and at times you may have to interfere and do the caesarean, where we are going to open the abdomen under anesthesia and take out the baby and safeguard the mother and baby with required drugs, we can say.
Yeah, yeah. Many times, there is a cord around the neck. The
So,
baby will have the cord. In the past, it was not made out.
that is also
But
another.
now, everything can be made out. And the baby, if there is a distress, and then
Yes,
you can see that in the fetal scopy, the heart rate is coming down, and then there is a danger.
Non-stress test.
Yes, yes.
Ah.
So,
On the abdomen, usually we tie the belt with the non-stress test instrument, that is cardiotopography,
okay.
where we can see the up and down of the heart rate of the baby. So now it is a evidence-based, and most of the time in most of the private hospitals, of course, the husband or the kith and kin are available. They also follow.
He's standing there, he
1 week
knows.
and all. That is the one thing we can say. So
Yeah.
cesarean section is done at particular indication. That is very important. But normal delivery also should be given at a particular monitoring and supervision of the experts, we can say.
Yes,
We cannot
yes, yes.
afford to lose the mother or the baby at the
Yeah.
cost.
So I remember in the past, when it used to be difficult and the head is stuck, they used to put the forceps and pull the baby. And then,
Yes.
there used to be compression on the thing, and the child used to become deaf. And many a times injury. And then if the
Hemorrhage.
shoulder is caught, and then the shoulder used to be dislocated, and the child used to have a paralysis.
Yes,
And
yes,
so
yes.
many complications were there.
Correct.
So
Correct.
blaming unnecessarily is not required. So when it is required, cesarean facilities are there, do it. When normal delivery is possible, do it. So the judgment, it has to be tailor made for that
Yes.
particular patient and that particular child.
Individualized.
Yeah, decision has to be on the spot at that time. Like the
Yes.
masterly activity you said, no, the masterly decision has to be taken in time to save the baby as well as the mother. So
Yes.
today we can't afford to lose the mother or the child, and
Yes.
because both are very precious, it is not like the olden days. So we should not blame that cesarean sections are increasing, normal delivery is coming down. It is all because of the altered lifestyle and the way the women are
Correct.
changing their pregnancy period and other things. No? So earlier by 20, 25 years, all the
Yes.
deliveries are
Yes.
over and they are happy. And
Yes.
within no time, their children used to be helping them. But today it is not like that, and the older child would take care of the younger child. And this is how it used to be in the home. But today the things are changing, and many women have they face lots of problems during the pregnancy and delivery. And hence I think, we should not blame anybody. Instead, understand why it is done, because it is an evidence based treatment that we are giving. So thank you very much, Dr.
Thank you,
Parimala
madam.
Devi. So
Thank you. Thank you.
beautifully, so nicely, and so in such a simple word you have explained why the cesarean sections are done and why
Just
they are
ಒಂದು
very
ಸೂಕ್ಷ್ಮ
precious.
ವಿವರಣೆ ಅಷ್ಟೇ ಮೇಡಮ್, ಇದು ಒಂದು
Okay,
ಸೂಕ್ಷ್ಮವಾದ ಒಂದು
okay,
ವಿವರಣೆ.
okay, okay.
Thank you, madam,
Thank
for
you,
giving the
thank you,
opportunity.
thank you.